Welcome to the module, Respiratory Syncytial Virus Vaccine, What You Need to Know, a Frontline Forces training presented by Superior Health Quality Alliance. Learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. This course will provide information about respiratory syncytial virus, RSV, and the new RSV vaccine to build on your current knowledge of vaccines. Direct caregivers play a very critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of these individuals. The purpose of this course is to further your learning and build on your current knowledge about the RSV vaccine. What you know and how you use the information improves the quality and safety of the patients you care for. This learning module, RSV, What You Need to Know, is a part of a series of modules exploring different vaccines that are helpful in keeping caregivers and the patients they care for safe and healthy. You are viewing the fifth module of the series, which provides a general overview about the respiratory syncytial virus and the RSV vaccine. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any of the modules at any time. Once you have completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. Upon completion of this module, you will be able to describe respiratory syncytial virus and its complications, identify the types of RSV vaccines, explain who should get the vaccine and when, discuss the importance of getting the vaccine, and describe the side effects from the RSV vaccine. What is respiratory syncytial virus? Before learning about the new respiratory syncytial virus vaccine, it is important to have a basic understanding of the respiratory syncytial virus. Most likely, if you have young children or know someone who does, you have heard of this virus, which is commonly referred to as RSV. RSV is a highly contagious respiratory virus, much like the common cold, with mild symptoms. However, it can be serious and lead to hospitalization for infants and older people. RSV can cause an infection of the lungs and the lower respiratory tract and can lead to pneumonia and bronchiolitis, an inflammation of the small airway passages leading to the lungs. The RSV vaccine can prevent against lower respiratory infections associated with RSV. What are some of the complications from RSV? RSV can cause significant complications that require hospitalization, mechanical ventilation, and can even cause death. Pneumonia and bronchiolitis are the two serious complications of RSV in infants and older adults. RSV can worsen symptoms of underlying health conditions, such as chronic obstructive pulmonary disease or COPD, asthma, and congestive heart failure. RSV can also cause repeated infections within the same season, middle ear infection, and pneumonia in adults over the age of 60 years. Each year, 58,000 to 80,000 children, about the seating capacity of the Notre Dame Stadium, under the age of 5 years are hospitalized, and between 100 and 300 die annually during RSV season. The number of adults is astounding. 60,000 to 160,000 are hospitalized, and up to 10,000 die annually. Most of these adults are age 65 or older. What is the RSV vaccine? There are two different vaccines for adults ages 60 and older. Two monoclonal antibody injections for infants and toddlers, and one vaccine authorized by the U.S. Food and Drug Administration, or FDA, for use in pregnant individuals to protect infants after birth. The FDA approved the first vaccines for special populations of people. RSV pre-F3, Arexvy, and RSV pre-F, Abrevsmo, are one-time dose injections of recombinant stabilized pre-F protein. Fusion F protein is a surface protein. When attached to the viral surface, it infects cells to produce a more protective immune response. Nirsevimab, or Beyfortus, and palivizumab, Synagis, are monoclonal antibody products, not vaccines. These antibodies provide an added layer of protection to an infant's immune system to protect against severe disease, hospitalization, and even death. These antibody injections have been approved by the Centers for Disease Control and Prevention, or CDC, for the Vaccine for Children's program. A one-time dose of Abrevsmo has been approved by the FDA for use at 32 through 36 weeks gestational age to protect newborn infants. Who should get the RSV vaccine? Anyone can get RSV, but the groups who have the highest risk of being infected with a serious illness are children under the age of 2, adults 60 years and older, and those with underlying chronic health conditions. The risk for getting RSV is higher in premature infants and in children under 2 years with lung and/or heart disease, neuromuscular disease, and those with compromised immune systems. Adults 60 years and older with chronic health conditions such as lung or heart disease, compromised immune system, kidney or liver disease, diabetes mellitus, hematological disorders, cerebrovascular or neuromuscular disease, and those residing in a nursing home or long-term care facility. This population has a 30% higher risk of getting RSV. The RSV vaccine can help protect individuals with these health conditions against severe illness. Why should I get the RSV vaccine? RSV is highly contagious and can spread quickly from person to person via respiratory droplets from a cough or a sneeze. RSV can live on hard surfaces such as doorknobs, tray tables, and light switches for hours. Anyone can get RSV during the fall and through the winter season. You can also get the virus multiple times in the same season. However, getting the vaccine can help reduce RSV-associated hospitalization. As RSV typically surges in the late fall, it is recommended to get the vaccine along with your influenza vaccine. You can receive both vaccines at the same time in different arms. How effective is the RSV vaccine? Vaccines do not guarantee protection against RSV, and some people may still get the virus. The vaccine is highly effective at preventing severe illness in those who have the greatest risk. The CDC published the following data on the effectiveness of various RSV vaccines. The link to the source is available in the YouTube description or in the references below this video. Arexvy, RSV pre-F3, is 82.6% effective against lab-confirmed RSV in the first season, and 56.1% against the second season. Overall efficacy of one dose across both seasons is 74.5%. Abrevsmo RSV pre-F is 88.9% effective against lab-confirmed RSV in the first season and 84.4% in the second season. The efficacy of one dose across both seasons is 84.4%. Long-acting antibody products for infants and toddlers have been shown to reduce the risk of hospitalizations and healthcare visits by 80%. When and what type of vaccine should infants and toddlers get? RSV antibody recommendations are for children 2 years and younger. 1 dose of monoclonal antibodies, Beyfortus or nirsevimab, for infants 8 months and younger who are born during or entering their first RSV season. For children between the ages of 8 to 19 months who are immunocompromised, a second dose of Syncytial or palivizumab is recommended during their second season. The RSV antibody should be given with caution to infants and toddlers with clinically significant bleeding disorders and a history of anaphylaxis. When and what type of vaccine should adults get? RSV pre-F is recommended for pregnant individuals 32 through 36 weeks gestation to give their unborn baby an added boost of protection against severe respiratory illness. Adults age 6 years older may receive a one-time dose of RSV pre-F3 or RSV pre-F using shared decision-making with their provider. Recommended timing for the vaccine is before the onset of RSV season. Evidence indicates individuals over 60 with these underlying health conditions have the highest risk for severe RSV. Chronic conditions like lung, heart disease, and diabetes, neuromuscular and cerebral vascular disease, kidney and liver disease, immunocompromised, hematological disorders, or residents in a nursing home or long-term care facility. What are the side effects of the RSV vaccine? Mild side effects are associated with the RSV vaccine, and they usually go away within a few days. Side effects include pain, redness, and swelling at the injection site, fatigue, feeling tired, fever, headache, diarrhea, muscle and joint pain. Neurological side effects were present in a few rare cases. Possible side effects for pregnant individuals are pain at the injection site, headache, nausea, and muscle pain. Some possible side effects for the antibody vaccine for infants and toddlers are rash, pain, redness, and swelling at the injection site. Who should not get the RSV vaccine? There are only a few reasons someone might not want to get the RSV vaccine. People with severe life-threatening allergies should talk with their provider prior to receiving their RSV vaccination. People who have had reactions to previous vaccinations should talk with their healthcare provider prior to getting an RSV vaccine. If you have a mild illness like a cold, you still may receive the RSV vaccine. However, if you have a moderate to severe illness or fever, you should wait to be vaccinated until you are fully recovered. Pregnant individuals who have a history of preterm labor or miscarriage should use shared medical decision-making when considering the vaccine. What preventative measures can I take to protect my loved ones? You can take these steps to prevent the spread of RSV by following a few simple steps, which include wash your hands frequently, sanitize your hands when you're either entering or leaving a room, avoid touching your eyes, nose, and mouth, avoid close contact with people who are sick, cover your coughs and sneezes with your arm, stay home when you're sick, clean and disinfect high traffic areas, and if you are symptomatic, wear a mask.
It's now time to test your knowledge.
Congratulations, you have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Respiratory Syncytial Virus Vaccine Quiz on the Frontlines Forces webpage or in the YouTube description below.